Hey, what's up, Corny? Not much. How are you guys?
Did you really just look behind you like, Courtney?
Weird.
I don't know.
So we started recording this, and yeah, Stephanie, it was really delayed. I agree with you. It was driving me nuts.
Okay.
So sorry about that one. I don't know. They were having huge issues with the internet. I think that's kind of what it was. All righty. Do you guys want me to put it in the document? Can you see the document, or you want me to, like, for those that are in the class here, that you want me to put it full screen? Is that okay? Can everybody read it if I get away from here? Yeah. Okay. So Steph, if I understand what you're saying, you sent a text out to everybody that said, "Hey, we're logging on here. Sign up or get in." Okay, perfect. So we'll just wait just a few minutes because, like I said, the announcement said around noon. But is there anybody that's here or online? There's a couple that have any burning questions that we need to address before we start things. And remember, this is a Q&A. So take a minute and look at the questions individually and say, oh yeah, I know this about PUD, peptic ulcer disease. Oh, okay. Okay, Maren. If you can answer these questions and feel confident with them, plus reading the chapter, which I know is an adverse thing for you guys. Review the lecture, review the notes. Like I said, the unit, I tried to highlight things that were important. I tried to add medications that were in the classifications so that it was a little easier to study. This is a very straightforward unit, but you still have to know the meds. You still have to know adverse reactions, and because the questions aren't regurgitation, they're taking these characteristics of these drugs and they're placing them in situations that you have to make choices about. So that makes it a little complicated. All right. Let me take a look on things here. All right. What is it?
I said I read for leisure, not for leisure.
Okay. All right. So do you want to kind of answer online? You want to wait just a minute? What do you guys want to do?
I have a quick question, Debbie.
Sure. Sorry, let me turn you up because I'm not quite hearing you a little bit. Okay, go ahead.
So I was studying the antiemetics last night, and I noticed that a lot of them did say it's really good for during chemo treatment and stuff. And I couldn't remember if you said during lecture if Zofran was the best drug that they give. Would you say that?
Yeah, you're going to have to talk louder. Are you in your car? I heard about half of it. There was something about Zofran, antiemetics, and best choice. Are you talking about what is the best choice for Zofran? Over here.
Type it. Timing.
Oh yeah. Don't type it, Maren. We'll get the question answered. Don't type if you're in the car. Say it one more time. Oh, it looks like she's got her mic off. Okay, so
Sorry, can you hear me now?
not great. We're kind of hearing more in the background, but we'll try it.
Okay, hold on one second.
Okay. She's pulling over. She's probably pulling over. Makes me feel better.
Is that better at all?
Oh, that's beautiful. Yes.
Oh, good. Okay. So my question was, when it comes to antiemetics and nausea and vomiting associated to chemotherapy,
Yes.
I couldn't remember if you said this in the lecture, but is Zofran the best for that? I couldn't remember if you said.
Yes, and if you review the lecture, I did. I made a clarification. Zofran is the best for along with other, antiemetics. But when you're talking about preventing vomiting in patients with chemotherapy, they will load them with Zofran, as opposed to like Decadron or dexamethasone, which are steroids. They'll load them with Zofran first, give the chemotherapy, and then give other drugs in association with that. But Zofran's the best to prevent nausea and vomiting in chemotherapy patients.
What was developed for that, wasn't it?
Yeah.
Okay,
Yeah.
that makes sense. So that one loads it up, and then the steroids you mostly give just the one time because of the long life.
Right. And
Okay.
Corby made a great, as she always does. Zofran was created for chemo. We were just able to find that, holy smokes, this works in many sorts of reasons when people are throwing up. But originally it was created for chemo. So I'm going to ask a question for those people that are online and here. Don't type it, Maren, you're driving. So if a person says, oh, I throw up a lot when I have surgery, what medications would you think would be best for an antiemetic? Yeah. Remember, there's like 8 or 9 different types of antiemetics, and I said you needed to know them. That's an anti-ulcer drug. That's not an antiemetic. She said H2 blocker, and that was an anti-ulcer medication. So which one do you, I know you guys are like frantically looking, okay, but there is a situation where you're going to need to know that. So what antiemetic drug is best for when people get sick from surgical procedures? Yeah, for anesthesia.
I was gonna say the nurses give them Zofran.
I thought it was Zofran. Well, Zofran's usually given after surgery, not
Yeah.
pre-surgery.
Yeah, not
Oh my gosh,
pre-surgery.
I know this.
It's given after surgery.
This is something that would probably be given more pre-surgery. I've seen it, but I can't remember the
Yeah.
name of it.
If you work PACU, or if you've seen PACU, if you've been able to have clinicals in PACU, they use it a lot. Corticosteroids, yes. Because think about it, corticosteroids, which Stephanie, that's a good answer. It has a little bit of reactions, promethazine, and so the corticosteroids are given in pre-op because they have a long half-life. And so it goes through the surgical procedure and after, and so it is corticosteroids or dexamethasone, okay? And that is one of your drugs to know. You've seen it before. It's interesting that a steroid would help with antiemetics, but again, you have to look at where these drugs act on, whether they're acting on the vomiting center or the chemoreceptor zone, trigger zone, which are right next to each other in the brain, which is right next to the vestibular, which is where your ear is. All right, so let's move on here. Any other questions on that one? Does that explain well for you, Maren, what you were questioning? Okay, so moving on. What are the predispositions or predisposing factors that cause peptic ulcer disease? You need to know that. Stress is one of them. Good job. What else? I wrote 39 of the same things of the number one predisposing factor in your learning activities. Nope, you gotta look at your learning activity. Alcohol does. H. pylori is the number one cause of our number one predisposing factor. Okay, so I know that you guys are kind of like up to your eyeballs in learning activities. But I spent a lot of time going through each learning activity question to help clarify. I made comments in your document to clarify, to make sure that there was greater understanding, and to give you greater clarity in terms of for potential test questions. So it will be helpful if you review it. Okay, so what medications are used to treat peptic ulcer disease? H2 blockers, that's one. What else? PPIs, antacids. What else? Antibiotics for H. pylori. And there's one other thing for when you actually have a lesion or a sore.
What's that thing that puts the Band-Aid on?
Yeah, it's the medication that puts the Band-Aid. Reglan can be used, Steph, yeah, but it doesn't put the Band-Aid over the ulcer. That's right. There you go.
One thing.
That's right. Right. Also known as Carafate. Okay. Good job. Okay.
You know what the Band-Aid was when you said put the Band-Aid.
Yeah. Did you know what the Band-Aid was? Good that you remembered the Band-Aid. Now you need to remember the medication.
I thought I would know.
Okay. What's the benefits of using an H2 inhibitor over antacids? Ooh, I know. That's a hard question, isn't it? Kylie just woke up and said, wow.
What?
Yeah.
I'm awake.
I'm awake. Kenna's doing her cards over here. Okay, what's the benefits? Okay, antacids are short. What does H2 inhibitors do? H2 receptor blockers, what do they block? Yeah. They produce, they inhibit the secretion of gastric acid. So is that what antacids do? Say that really nice and loud so everybody can hear it, Mapu.
Antacids treat the symptoms, but they don't prevent or stop death, right?
Yeah. So they neutralize, that's the word you were looking for, Kim.
Yeah.
They neutralize the acid. So they raise the pH. They're short term, but they don't do anything about decreasing the amount of acid you have in there. Because they don't block anything. They just neutralize the volume. They don't block the secretion of the acid, which if you have peptic ulcer disease or if you have a peptic ulcer, that's one of the things you want to do is to decrease the acid. So let's talk about drug combinations. What would you anticipate as the nurse seeing if a patient has a peptic ulcer? And I clarified what a peptic ulcer is on your learning activity. It's different than a gastric ulcer and it's different than a duodenal ulcer. I know, everyone's like, oh, these questions. A peptic ulcer is where? It's not in the duodenum, it's not in the stomach. Where else could it be? Esophagus. It's in the esophagus. Okay, so what drugs or classifications of drugs, so pharmacology, would you anticipate to help with that ulcer, that peptic ulcer? Okay, medications for GERD. Okay, but you have an ulcer, so what would be that? A PPI, that's definitely right, and there's going to be some other things too. What else? And this is common in treating GI disorders, is a combination of drugs. So PPI is one, but it's not the only one. What's the rest? This patient has an ulcer in their esophagus. An H2 blocker is in addition to a PPI because both of them do what? Yeah, they reduce the acid by blocking the receptors and blocking the histamine that produces gastric acid. What else? So we have 2 of the 4 that are used for ulcers. And you got to know this. There's questions on it, guys. There's questions. Okay, so combinations of drugs to treat an ulcer. We're talking an esophageal ulcer right now, a peptic ulcer. Stephanie said H2 blocker, PPI. Steph's now chiming in with an antacid. That's the third thing because it neutralizes the acid that's in there. The PPI and the H2 reduce the amount of acid that's going into the stomach. And what's the fourth? The pepsin inhibitor, which is called what? What's the pepsin inhibitor? Carafate, which will coat the ulcer. Okay. Yeah. There's another one called, that's an anti-ulcer drug called Cytotec. Okay. What do you know about Cytotec that is good and bad? When would you not use Cytotec? It's, contraindicated in pregnancy. Pregnant women get how do I say ulcers, but they get heartburn constantly, especially as the baby gets bigger and it pushes the stomach up. So would Cytotec be a good drug to use? No. What would be good drugs to use in pregnancy? PPIs. Are PPIs safe? So Steph says an antiemetic. I agree with that if they're having nausea. If they're having heartburn, what is heartburn caused from? Yeah. Heartburn is when that acid goes back up into the esophagus. Famotidine? Or what do you?
I think that's it.
Okay. You think that's it? Okay. So you need to know which drugs are okay in pregnancy because they do get heartburn. And that's important. Okay. So when there's an ulcer, there's 4 combinations of drugs. When there's not an ulcer, when there's just a lot of acid in there, there's 3 kinds of drugs. What do you think that 4th one would be when there's an ulcer versus when there's not an ulcer, there's just inflammation and pain? I'm sorry, say that one more time. Yeah. When there's actually an ulcer. Yeah. Important to know. So when you have an ulcer, there's 4 different kinds. The antacids that neutralize, the PPI and the H2 blocker that reduce the gastric secretion. So it reduces the amount that goes into the stomach. And then the Carafate, which covers the lesion so that it can heal. So let's talk about ulcers. How long does it take for them to heal?
A long time.
1 to 2 months. That's what it is.
See the peptic ulcer in the esophagus?
Yeah. It's still under the peptic ulcer umbrella because a peptic ulcer can also be a gastric ulcer. It can also be a duodenal ulcer or an esophageal. Remember, it's that umbrella. Peptic ulcer is an umbrella.
Okay, so it's an esophageal peptic ulcer.
Yeah, but they classify because gastric and duodenal kind of have their own, specific positions. You can say it's an esophageal ulcer, or you can just say it's a peptic ulcer because that's the only one that's left.
Yeah, but peptic ulcer could be gastric or duodenal.
But those are the ones that are identified. So if it's not identified, it's the esophageal. Does that make sense?
Sure, that makes sense.
Okay.
Let's go with it.
If it's not specifically identified as a gastric or a duodenal, it's an esophageal. So how do you know if you have an ulcer?
It hurts.
They come in and they say, I have this pain. I have an ulcer. I want you to prescribe me medicine. What do you do? What, Kenna?
So you're not the doctor, you don't prescribe it.
Right, you don't prescribe it. What would you anticipate would be the next step?
Get our history, Stephanie says get our history.
Yep, definitely get the history. Do you just hand out antibiotics because they say I have H. pylori?
Sure.
Yeah, you have to know what you're treating, and especially in GI. Somebody comes in abdominal pain and they say, "Oh, I'm constipated. I need a laxative." Okay. Sometimes, a lot of times patients are right, but is that something that's just okay to do without any kind of evaluation? Yeah, you have to know what you're treating. So further evaluation and to make sure, I'm sorry, I may not be. Yeah, ask more questions. And you have to know. So H. pylori, you're not going to give antibiotics until you know that they have H. pylori. Okay. And what else would you anticipate the treatment regimen for H. pylori? You said antibiotics. What else?
No, because you want them to get rid of it.
Okay. But it hurts in their stomach.
H2 block.
Yeah, H2 blockers, PPIs, and acids too. Okay. So again, people with H. pylori are going to have 4 different kinds. They're not going to have an ulcer because it's the H. pylori, it's the bacteria that's causing the problems. So you have to eradicate the bacteria. That's what the antibiotics does. But you still have pain from the acid, right? So it's going to be treating with what you would treat, reduction in acids, and neutralizing what's in there. All right, how do you tell the difference between if it's a gastric ulcer or a duodenal ulcer?
How long it takes to start.
Say that really loud.
How long it takes to start hurting after they eat.
Or when it hurts.
Yeah, how long it is, where, did you say when or where it hurts, Kenna?
I said when, like if it's in the middle of the night and they haven't been eating.
Okay. Yeah. So how many hours after you eat? 1 to 2 for what? Gastric. What about if it's a duodenum?
Or 3 to 4-ish.
Yeah, it's going to be longer than gastric because once you put food in the stomach, what does the pyloric sphincter do? No, opposite, Mark. Okay, remember that duodenal ulcers are caused because the acid is able to go into the duodenum, which is just right past the pyloric sphincter. So you want a decrease in acid, but when you get food in your stomach, that pyloric sphincter closes off because it has to break down the food, and it doesn't want food shoving in through into the duodenum till it's broken down. So that means acid isn't getting sloshed onto that ulcer. So do you think they'll feel a little better because they don't have acid on the ulcer? Yeah. Yeah. So that's the reason why it's delayed, is because the body closes off that sphincter, works on the food, and the person goes, "Oh, I feel better." But then 2 to 3 hours later, 2 to 4, whatever, longer, okay, that pyloric sphincter opens up, and then the food or the chyme goes through and then hits that ulcer, which is when it starts hurting again. Does that make sense? Okay. What else do we need to talk about? Tell me if a person has GERD and they've been prescribed some medication for that, what's it going to look like if they're getting better? What are you as the nurse going to see that the treatment is working? Okay, so they wouldn't have heartburn, right? The heartburn would be decreased. I agree. What else? What are signs and symptoms of GERD?
Like
They don't like to
lay
find that
supine.
Well, that's how we help. That's how we help fix it. Yeah. So we want them to kind of stay inclined. But is that going to tell you they're better? Okay. So what else? What are signs and symptoms of GERD? You said heartburn. What else?
Then so there's for them to eat, not as difficult because they don't have like the dysphagia that comes with GERD, I guess. And all the
The belching.
What their appetite? What do you think about their appetite? Is that going to change? Okay, less pain. What are signs and symptoms of GERD? Look in your book. You got to know this. Okay. Belching? Yes, you bet. Is signs and symptoms of GERD, does it have diarrhea? Okay. There's one other thing. You talk about burping. What are you belching up? Well, yeah. So what do you think is going to happen in the throat? It's going to burn. So you're going to sore throat is a symptom of GERD. That's in your book. So if you get a question that's like, what are the signs and symptoms, and select all that apply, gotta know them. Gotta know them. There's not 20. Okay.
Let's look at all that as 30.
So, Prevacid is what kind of a drug?
Prevacid is PPI. Prevacid is that?
Prevacid. Previcid. Prevacid. It's a what? Remember, it ends in ZOLE. Zol. Okay, PPIs are ZOLE. Good job. You're right, Steph. It is a PPI, and it is lansoprazole. Okay, so when would be the best time to give a PPI? When would be the best time to give a PPI? When should they take one? Okay. Is that a statement or a question? Okay.
Like you have to take multiple times.
Well, think about it.
Or each meal.
Steph said it works up to 3 days, and it does. So once that proton pump has been inhibited, it's irreversibly inhibited. Okay. It doesn't work till the body produces another PPI cell. Okay. So how many times a day do you think this is taken? That's in your book. It's in your book. Yeah.
You said that I was saying it, so.
Yeah. One a day. Yeah, one a day. And it is one that can be missed, especially if they're NPO or something, because just like you said, it can last for days. So, but again, I go back to when is the best time to give it? Because what does a PPI do? Proton pump inhibitor, which what? Decreases acid. Do you eat in the morning? So when should you give this? Before breakfast. Right. How long before breakfast? How long before breakfast? Yeah, at least 30 minutes. Exactly. What are some of the other ones? The H2 blocker or antacids, and how do they interact, especially antacids, with other medications?
Take it together.
Okay.
Take it at least hour.
Yeah, 1 to 2 hours before, because that antacid raises the pH. And so other medications that are like enteric coated, so that they don't dissolve in the stomach, because the stomach has such a strong acid, it's designed to dissolve in the duodenum. If you raise the pH from an antacid, it'll start to dissolve. So yeah, 1 to 2 hours. Good job, Steph, prior to eating. Yep.
Debbie,
All right. Yes, go ahead. Sorry.
I have a question because this kind of ties into the very last question of 20. So they tell you not to like mix antacids with any of your other meds, right? 1 hour before, 2 hours after. But then there's drugs that have antacids mixed with H2 blockers. So how is it that you can mix the medication and it'll work? Like simethicone, I think is what it's called. But you can't take an antacid with an H2.
Right. And
as separate meds. Why can you combine it but not take them separate?
so it has to do with the mechanism of action, and the purpose of simethicone is to reduce gas. So where do you think that one's going to work on?
Like into your intestine?
Right, exactly. So it kind of passes through the stomach, which is why you can kind of have a combination of those, because it's not gonna start working till it gets into there.
So the purpose so they're combined, but the purpose has nothing to do with ulcers, which is why it's okay to combine them, because you're okay if it changes the acidity of the acid.
Right, but
Okay.
does simethicone change acidic level?
Well, technically it should neutralize it because it's an antacid. It's an antacid with an H2 blocker. So technically it should reduce the amount of acid as well as neutralize it.
The H2 reduces the amount of acid. The antacid helps to neutralize the volume. And depending on which chemicals and how they combine them to take one is a good thing, right? So you're not having to wait 30 minutes, take this medication 30 minutes before and then take this medication or wait 2 hours before. They have found that some of the antacids you can take with an H2 in the combination that they develop. Does that make sense? Meaning it's not as strong.
Specific combination that they find works. Where
Yeah.
if they take them separately, the combination is off. Does that make sense?
Did you hear that, Stephanie? What
Probably did not.
Corby said?
Yeah, it makes sense.
Okay. All right. So we talked about what medications work or work better when used in combination with something else, like peptic ulcer disease and GERD. We talked about those combinations. What are those combinations? An antacid. What else? With an H2 blocker, and what else? It's the different classes of drugs.
Lomotil is a combination drug, right? Think about here,
No, Lomotil is used for what?
diarrhea.
Diarrhea. We're talking,
We're not talking about all combinations.
yeah. We're talking peptic ulcer disease, talking GERD.
Something with paraffin.
If there's an ulcer, Carafate. So PPIs, H2 blockers, antacids is standard level of care for peptic ulcer disease and GERD. If there's an H. pylori, which is H. pylori a bacteria, virus, protozoan? What is it? Okay, it's bacteria. Then you're going to add antibiotics into that mix. Does that make sense? This is when people respond.
Yes.
Yes.
Debbie, did you go into which antibiotics treat H. pylori?
I didn't, but we did go over that in class. And there was a couple that were highlighted. What slides were highlighted for antibiotics? There was like 4 of them listed, 2 of them highlighted. Yeah, what antibiotics are.
Amoxicillin.
Yes, amoxicillin is one. What's the other one? Yeah, clarithromycin. Those are the 2 antibiotics that are mostly prescribed from the book. And that's what's going, if you're asked a test question, that's where it's coming from, is your book. Real life, because this has changed since you've, since this book's been out. If you look, there's a Flagyl. Is Flagyl not on? Yeah, that's where they go to now. They go to Flagyl, and then they do go to amoxicillin. Flagyl is intense, has a lot of side effects. But when you're talking about eradicating, that's why they do it. But for the purposes of this test, the 2 that were highlighted, which is amoxicillin and clarithromycin, are the ones that, if you're asked that question, you want. Those are the ones that are used to treat H. pylori. Comprende? Okay. I didn't. Well, yeah, we kind of started. Okay, so are we good? Is there anybody else? There doesn't look like a lot of people are logged on, so this tells me you guys are going to get 100% right.
Yes.
Okay, I have a question on diarrhea medications or constipation medications. There's one that specifically addresses problems with the liver. Like if you have hepatic encephalopathy, which things aren't clearing from the liver, your liver's dying. And so you're not getting rid of the ammonia. There is a laxative specifically designed for that. What is it? Say it nice and loud. Lactulose. Okay. So also look at your antacids, because your antacids, especially one that has magnesium, when it gets in the bowel, guess what happens? Magnesium kind of irritates the mucosa and they end up with diarrhea. So if you're taking an antacid that causes diarrhea, is there other antacids that maybe cause constipation and could cancel each other out? Yes, that's important to know. Because again, it just neutralizes the acid. So if one, you could add another one. And if you're having side effects from one, another one would be a good thing to add, especially if you're talking about diarrhea. What about somebody that's on opioids and they have constipation?
Okay, what for them?
Don't what?
Opioids, people are taking opioids.
But what is, okay, that's true. So what do we do to prevent constipation? Remember, there was 4 different kinds. There was osmotic, there was stool softeners, there was bulk, bulking up. When you're talking to prevent constipation, like people that are pregnant, or if they're having surgery, or they've had surgery or a heart attack, what category, what would you do? What is the best medicine for that?
Ambulation, exercise, yeah.
Colace.
Yep, Colace.
The reason why they tell you to get up and walk around.
Docusate, right. Understand surgical, MI, or prevention of constipation. Colace is the best. Okay, and Colace is safe in pregnancy. That's important to know. Any other questions? No, we're good. You guys feel good about this?
Never. Not anymore.
Okay. No. All right. Okay. Any other questions before? What would be a contraindication of a laxative?
You have diarrhea?
Yeah, agreed. Dehydration. What else? Like they have abdominal pain and they think they think they're constipated. Could it be anything else?
Obstruction.
Could be an obstruction.
Low potassium.
So how would you find any of that out?
Labs and imaging and talking to your patient and history and
Finding out what the reason is, right? Yeah.
whatever.
Further evaluation, laboratories, CTs, things like that. That's the first thing you have to do before you add medications. You have to know what you're treating.
Any medication too, even pain medicine.
Yeah.
If you're in writhing and pain, you're not gonna be like, okay, let's give you some morphine.
Okay.
You gotta find out what that abdominal pain is before you give any medication that's gonna affect their bowels.
And remember, what is the best classification of drug for to fix diarrhea? Okay, but which anti-diarrheal, Kim, is the best for severe diarrhea? Say it again. opioid with atropine, right? That's one of your medications, and it is diphenoxylate with atropine. Okay, so
You give antidiarrheals to kids.
No.
No.
yeah,
Do not give antidiarrheals to children.
yeah. And what if a kid went in and because he's had constipation, and the physician doesn't say no, he doesn't need a laxative? What would be some non-pharmacological things you could do to help the child get rid of the constipation where medications aren't indicated? Okay, water, hydration. What was some other things? Activity, exercise. Yeah. Yeah, no enema. Yeah, the non-pharmacological things. Yeah, exactly. Oh yeah, that stimulates things, doesn't it? Okay, let's see. So when would you not give sodium bicarbonate for as an antacid? Sodium bicarbonate. What would be something that you would say, nope, can't have that?
Amylosis.
That's right. Good job. Yep, you nailed it. Because they're already alkalotic. And then you're going to give them more of that. That's not good. No bueno. Okay. I'm just looking at the math. And you've got some math. What medication is the best for traveler's diarrhea?
Pepto-Bismol.
If you guys
Don't drink the dirty water in the first place.
That's right.
if
Don't
you
drink the
guys
dirty
are
water.
missing the math, like, I request maybe that you come and see us and figure out why you should not be missing math questions.
Because you tricked them.
That is really huge and can be really dangerous if you're not understanding why you're missing it. You really need to come talk to one of us and try to figure out why you missed it. Because some of these calculations that you guys do, if you were to give a dose or the tablets or the milliliters that you figure out to your patient, you could kill them.
That's true. Did you hear Corby
So
online?
it's really, really imperative. If you really don't understand why you missed the math, please come ask us. As a nurse, it is huge. You have to get that right every time.
Yep.
Or it can be the difference between therapeutic dosage and death. Like, I'm not even kidding, it's huge. Especially when we get into like diabetes and figuring out insulin,
Yeah,
carb
yeah.
counting and stuff, like you've
Yeah.
got to know it.
If you're missing Pepcid dosages, by the time you get to diabetic and insulin and stuff, you're toast. You're toast. Because these are high risk medications at that point in time. So I have a question on motion sickness. Which category of medication is, scopolamine, but what kind of medication is it?
Anticholinergic.
Yeah. Yep. Anticholinergic. So what would be a very common side effect that you would see? Being dry mouth, constipation, what else?
Drowsiness.
Drowsiness. Exactly. How long can you keep a patch on?
3 days
Okay. Where does it go?
behind the ear.
What time? When do you put it on?
Before 30 minutes before.
Yeah, 30 to 60 minutes before. It can be upwards to an hour. Before you get on a plane, go on a ride at Disneyland, get in the car, that sort of thing. What's the difference between Lomotil and Imodium?
Scheduled substance.
Yes, it's a scheduled substance. It's an opioid. So that means it's what? If it's controlled and an opioid, you need a prescription. And what about Imodium?
Over the counter.
It is over the counter. Mm-hmm. Yep. Okay. Corby says I have to stop.
I think you should keep going.
Okay. So you are going to need to know these drugs. So please open your book, okay? Because I gave you hints of things to be able to look into, okay? I didn't give you test questions, but these are the kinds of things you should be asking yourself. from the clarification document and being able to understand these drugs, how they work with each other, how they're different from each other, and what purposes are they beneficial in. Basically all of the, oh, and don't forget there's a question on peppermint and there's a question on ginger. Okay, so, and then your math. All right? We pray for you guys. Truly we do. So,
We pray for ourselves.
you pray for yourselves. I know. This is straightforward, but you do need to know the material. Okay? We're good? That's great. Okay. All righty. Then we will stop this, send it out in the chat. Hopefully won't take 12 hours to post and go from there. Okay? All right, guys. Good luck.